how are the Albanese Labor government's actions to strengthen Medicare helping Australians access the health care they need while relieving cost of living pressures? And why is the government so determined to strengthen Medicare after a decade of cuts and neglect?
Call to the Minister for Health and Aged Care.
Thank you, Speaker. The member for Robertson is this talented young emergency physician who decided to pause his promising medical career to run for parliament and deliver better healthcare services for his community on the Central Coast. And on this side of parliament, we count ourselves so lucky that he took that decision, because working shifts every day in the Wyong Hospital and the Gosford Hospital, he saw shift after shift the consequences of 10 years of cuts and neglect to Medicare under those opposite. And he argued, for example, for the reversal of the decision that the former government made to cut the ability of general practices in the Central Coast and the Hunter Valley to recruit overseas trained doctors, a decision that hollowed out general practices right through that Central Coast and Hunter Valley community. And that's why we did reverse that decision. And that decision came on top of a 6-year freeze to the Medicare rebate, a freeze that was kicked off by the Leader of the Opposition when he was the Health Minister because he could not get his infamous GP tax through the Senate. Well, the Labor's approach, the member for Robertson's approach, could not be more different than the approach of the Leader of the Opposition. While he tried to abolish bulk billing altogether and make every single Australian pay a fee every single time they visited the doctor, in the May budget we tripled the bulk billing incentive, the biggest ever investment in bulk billing in Australia's history, and one that's particularly important for the Central Coast in New South Wales, which has one of the lowest bulk billing rates in the country, Mr Speaker. But the member for Robertson also promised his community a Medicare urgent care clinic to make it easier to see a doctor for one of those urgent, non-life-threatening emergencies, but also to take the pressure off those local hospitals he'd been working in as an emergency physician. And he delivered on that promise, because the Peninsula Urgent Care Clinic is now open 7 days a week, extended hours, fully bulk billed, delivering services to the people of his community. And it's already making a difference, Mr Speaker. Christine sent a message to Dr Gordon Reid, said, "I want to thank you so much for your work in providing the Peninsula Medicare Urgent Care Clinic. Our son had a red, swollen spider bite and was able to see a doctor after work this afternoon straight away." And he got an emoji too, Mr Speaker, a trophy emoji and a golden star emoji as well. Ginny took her son in at 8:30 a.m. on a day, got him seen within 15 minutes, fully bulk billed. Also thank their local member, because he is a terrific member for Robertson, who supports our campaign to strengthen Medicare, tripling the bulk billing incentive, rolling out urgent care clinics and delivering cheaper medicines.